Welcome everyone to Dr. John Bedker's Leadership Podcast, the podcast focused on leadership. The episode will begin shortly. Thank you so much for tuning in. Enjoy the podcast.
Welcome everyone. Thank you very much for tuning in to the Dr. John Bedker Leadership Podcast. I'm your host, John Bedker. Well, folks, today we're going to talk about an important topic, a topic with lots of variables and one that is really not polarizing, dividing, should be joining, should be easy. Not that the problem's easy, the problem is quite difficult, and that's a challenge of leadership. But we're going to talk about homelessness. Again, not a divisive, not an ideologically, politically separating issue. Should be one we all care about. Caring for our fellow man, our fellow woman. Doing the right thing to address this issue of homelessness. I'm going to spend some time talking about that in the current literature. I'm going to read from an article. I'm also going to give a specific focus on homelessness in the United States by veterans. Very, very important topic and very critical to me personally. So let me start with a bit of a quote to kind of kick this off. A little quick history. After the Vietnam War, people came back to a bit of a disgruntled country, of course. There was a period of high inflation coming back at the end of the Vietnam War. 2 economic recessions. Well, what happened? How did we deal with it? Well, then we were collective. There was a we. There was an us. And veterans began to be viewed as an important social and public health problem. A problem that needed government intervention, government support, and government resources. And so, there we go. Well, I'm going to read from this article, give you quotes from it. It's current. Lots of data. I think it's important to understand the facts, the analytics of this hugely important problem, and take a leadership spin on it. Okay, the article is by Alvin Powell, who's a Harvard staff writer. The article is dated January 24th, 2024. Title: Experts cite complexity of problem, which is rooted in poverty, lack of affordable housing, but includes medical, psychiatric, and substance use issues. This is the problem of homelessness. Okay, so there's the beginning of the article by Alvin Powell. Let's begin by talking about data. Always important to kind of set that contextual framework. December 2023 report by the U.S. Department of Housing and Urban Development said there were 653,104 Americans that had experienced homelessness. That figure was the highest since HUD began reporting on the issue to Congress back in 2007. So the December 2023 report, again, the highest on record, with 653,104 Americans in a condition of homelessness. All right, so not a great beginning, but certainly a call for leaders to not only know, but to be aware and to do what they can. We're going to talk about what some of those things are. All right, scholars, healthcare workers, homeless advocates agree. 2 major contributing factors are poverty and a lack of affordable housing. You'll hear me refer to that several times. Both difficult problems, both societal challenges. But the hard-to-treat psychiatric issues and substance use disorders also underlie chronic homelessness. All of which explains why those who work with the unhoused refer to what they do as the long game. No easy, short solution, no quick fix. They also call it the long walk or a 5-year plan. Yeah, that would be a good beginning to address this. So the commitment of leaders in leadership to this problem and resources necessary to do the job properly are hugely important, because there's many traumas that have to be addressed that underlie the reasons why a person winds up on the street. Stephen Wood, he's a visiting fellow at the Harvard Law School, said this: as a society, we're looking for a quick fix, but there's no quick fix for this. So says Stephen Wood. So, what's it mean for mortality? Let's look at that. In-game, right? Another hugely important data point to get this going. Well, this study was done in Boston, not surprisingly, coming from Harvard. But what do we know? Well, 2017, the life expectancy, housed person, 78.8 years. So almost 79 years of age, likely. What if you're homeless? What's that data look like? Well, the average age of death of homeless people in Boston, 53.7. 53.7. Decades less. Catherine Coe, another excellent researcher. I do like her work very much. She's an assistant professor of psychiatry at the Harvard Medical School. She's also a psychiatrist at the Mass General Hospital. She's on a street team, Boston Healthcare homeless program, out in the streets dealing with these people. She talks about community-based care, the need for affordable housing and social services, as well as a de-institutionalization of mental hospitals. So again, what are we hearing from a leadership point of view? Multivariate problem, not linear. We can't focus that laser beam and solve the problem. We're going to have to do a lot of things over a long period of time and dedicate resources regularly to mitigate this problem. Again, Stephen Wood, his quote, I think spot on to describe this. As a society, we're looking for a quick fix, but there's no quick fix for this. Doesn't mean that there aren't success stories. There certainly are. But where do those come from? From the research. It says these success stories come from positions of strong leaders and strong leadership, multidisciplinary collaboration, and resources to significantly reduce the problem. So prevention may involve interventions, may be focused on transition periods. Important to be aware of that. You, as a leader, should be aware of that. What kind of transitions? Well, people that transition from the military to civilian life. Discharge from active duty, returning to civilian life. Hugely important for leaders to be aware. There are challenges that are unique, that are special, and can be a problem as that military person is discharged and transitions to civilian life. People that age out of foster care, often 18 years of age. Hugely important to be able to be aware again, connect with those unique and special challenges for that young person still who is timing out of foster care. Not surprisingly, people that are released from prison. Hugely important intersection. Which way do they go? Left, right, to recidivism, or to a path of productivity? Well, awareness by leaders, resources by government agencies, state agencies, municipal agencies are key and critical in every one of these cases. So, recognition for leaders, important. Awareness, important. Homelessness is not merely a byproduct of other issues, certainly drug use, high housing costs, but it's also a huge problem in our cities. Experts say that means interventions have to be multidisciplinary, yet focused on the problem. So, for the research and for education to occur is critical for this next generation of leaders to do their job well. Leaders need training, knowledge, and experience to recognize those critical cues, to have their situational awareness high, to ensure that another person does not become homeless. So, what are some of the challenges here? There's some historical challenges, and I want to talk about those. It's an extremely complex problem. I think we've already seen that. But physical and visible embodiment of a lot of these public health challenges, because it really is a public health challenge, it's been happening all over. Well, the public health infrastructure has always been, and this is now quoting from Carmel Sacker. He's a faculty director at the Harvard Law School Center for Health Law, says that the public health infrastructure has always been the poor Cinderella compared to this larger regular healthcare system, particularly in terms of funding. We need increased investment in public health services. So just ask yourself, do I know where the local public health office is? Many people would say, I have no idea, right? Well, from a leadership point of view, folks, we should have an awareness. We should know. The public health workforce really needs to be engaged in this issue. People that are struggling need not only funding and resources, but they need trained, experienced, and knowledgeable professionals to assist them. Well, what happens? Well, oftentimes we wind up with a diagnosis, right? When in fact, it's a multiple diagnosis that's necessary. Oftentimes they begin by calling this a dual diagnosis, because what happens is, in the case that someone is recognized, that some caring person does reach out, they could either be admitted to a hospital with a substance use disorder, or they could be admitted to a psychiatric disorder. But very, very, very rarely will that individual be admitted to what's called a dual diagnosis bed. So says Wood, who's that nurse practitioner from Harvard. Okay, so this notion of a dual diagnosis bed, pretty important, because if it addresses just one issue, it may not be on a path to solving the problem. Okay. Experts, like Wood, say that the nation's unhoused population not only experiences poverty and exposure to the elements, but also suffers from a lack of just basic health care. And as a result, they tend to experience illness more, from simple things like the flu, and certainly in terms of pain and suffering, could be resulting in opioid dependency, and even in this day and age today in 2024, COVID-19. So let's look at some of this research and the results. We talked a little bit about the mortality gap between the homeless population and the general population. Sadly, I'm reporting to you that this gap is widening. It might be from drugs, could be from housing, could be from any number of reasons, and that's the key. It could be a multitude of reasons. But the point is, from a leadership point of view, this should be a problem that we can all get behind and all put a step forward to address it in a positive and affirmative way. Well, we talked about those roots. Where does it come from? Talked about Catherine Coe. Again, this researcher who I think has done some really excellent work. Here's something that she says, though. The journey to the streets often starts in childhood, when neglect and abuse leave their marks, interfering with education, the acquisition of work skills, and the ability to maintain healthy relationships. So, from a very young age, the roots of homelessness may be framing. So, if you're a teacher, if you're that person in the local church, if you're just anyone, anywhere, in any position, and you see this child that may be in neglect, may be in a situation of abuse, we as leaders I'm going to argue, must speak up and speak out. That early intervention is important. So, one of the things that Coe talks about in her work, I want to read from a quote, "A major unaddressed pathway to homelessness, from my vantage point," this is Catherine Coe, "is childhood trauma. It can ravage people's lives and minds, even until old age," Coe says. For example, some of my patients in their 70s still talk about the trauma that their parents inflicted on them. The lack of affordable housing is a key factor, though there are other drivers of homelessness that we must also tackle. So, from this very young age, we should be mindful. We should be aware. Because if we can help, that would be a huge leadership victory for whomever that person is that steps up, that speaks up or speaks out to help a young person. So, this dual diagnosis, important component of problem solving. Why? Because homelessness is increasing. All right? So, whether you're admitted to this hospital with one disorder or another, if you can get to that dual or multi-diagnosis bed, holy cow. So again, from a leadership point of view, what do we need to do? Well, we need to ensure that those places exist. We need to be supportive of doing that. Whether it's our fiscal policy, right? Are we going to appropriate money for such places? Whether it's education, are we going to train professionals, give them training, knowledge, and experience to help people in need? We need to resource that from a problem-solving point of view. Okay. Catherine Coe ends one of her articles this way, and I think it's important to share. We really cannot just house people and expect their problems to be solved. Again, we're this sort of quick fix generation in America, right? We want to think that there is this laser with single factor solution. It may be multi-factor. It may be highly resource dependent. It may take a long period of time. So we can't just put them in a place and think that the problem is going to go away. It's not. Okay, so what have we done? Well, we've done some good things, right? We've had some successes, and I've tried to touch on that. The U.S. Department of Veterans Affairs, for example, is a good story, is a good place to talk about success. What has the VA done? And I do want to highlight this. The VA has reduced veteran homelessness nationally by more than 50% since 2010. Well, how in the world did that come about? Well, then President Obama, during his administration, he put a push on. He enabled and empowered and resourced what leaders need to do, the Veterans Affairs Department, and put his political will to work to help those in need. So not only was the White House supportive, but Congress was supportive, and veterans received support and resources from a whole myriad of federal agencies to begin to address this issue of homelessness. What kinds of things did they do? Well, they funded research to learn more. A group of U.S. service members had found that self-reported histories of depression, of trauma, for instance, a loved one's murder, post-traumatic stress, those were three of the strongest predictors of homelessness after discharge. The Veterans Affairs addressed this. So, these critical transitions, military discharge, the release from prison that I've talked about, right? Timing out, aging out of foster care. All of these things require time and attention, maybe a lot of time and a lot of attention. But what will happen is we may be able to mitigate this terrible issue of homelessness in the United States. It's something that leaders can get behind. It's something that leaders can support by saying, I want to make sure as I go through my training, gain my knowledge, that I take that course in public health, that I understand more, that I read more to get a better fix on how homelessness could affect people in the organization that I am empowered to lead. Okay, folks, kind of a big deal, kind of an important issue, one we don't think about, but I do think it's a collective. We should all be able to care about those that do not have shelter, those that are homeless. All right, there we are. Thanks very much, folks. I really appreciate you tuning in. Take care. We'll talk soon.
Thank you for tuning in to Dr. John Bedker's Leadership Podcast. We hope you enjoyed this episode. Please tell your friends, and, of course, please follow our podcast and subscribe. Thank you again for tuning in.